A physician documented a patient recovery he spent the rest of his career unable to explain. A pharmacist confirmed a compound's existence, named by a man with no medical training, while unconscious. A woman was told her condition was psychological. Surgery found exactly what Cayce said it was. These are not folklore. They are dated, filed, and preserved in an archive open to researchers for 8 decades. Tonight, 5 case files. 5 documented instances where Edgar Cayce produced information he had no way of obtaining. Each one verifiable. Each one still without a complete explanation. Before we open the first file, the methodology matters. Cayce's readings fall into several categories: medical, life readings covering past lives, world affairs, and dream readings. The medical readings are the most testable. They involve specific claims about bodies, checked against independent medical records and patient outcomes. The process was consistent across 4 decades. A client would write to Cayce with a name and a location. His stenographer Gladys Davis would transcribe everything he said in trance. The date, client's info, and transcript were filed immediately. Follow-up correspondence was encouraged and preserved. There are 14,306 sessions in this archive. We are opening 5 of them. Case 1. Thomas Sugrue. Thomas Sugrue, a journalist, arrived in Virginia Beach in the late 1930s, a skeptic researching a biography on Edgar Cayce. He found something he could not categorize. During his time there, Sugrue developed a debilitating form of arthritis, a condition that progressed rapidly, leaving him significantly incapacitated. Conventional medicine offered limited options. Sugrue requested a reading from Cayce. The reading described his condition in anatomical terms that his physicians reviewed and found accurate. It recommended a treatment protocol, including spinal manipulations, specific dietary changes, and castor oil applied topically. His physicians found the recommendations unusual, but not harmful, and Sugrue followed them. His condition improved. Not completely, not immediately, but measurably over a period Sugrue documented. He went on to write There Is a River, the first serious biography of Cayce, published in 1942. He wrote it from a wheelchair, in the same house where Cayce was giving readings. He never fully recovered. He also never questioned what he had witnessed. A skeptic arrived to write the book. He left unable to write the conclusion the skeptic's framework required. That is the documented outcome of Case 1. Case 2. The Glyco-Thymoline files. This case troubles skeptics most, involving a specific, verifiable, and implausible pharmaceutical reference. In multiple readings across years, Cayce recommended a product called Glyco-Thymoline, a mouthwash and antiseptic for internal use in small quantities diluted in water. He recommended it for intestinal conditions and as a general alkalizing agent. The product existed and was commercially available. Yet, at the time, medicine did not recognize its internal applications. Researchers later found Cayce's recommended internal use anticipated applications with scientific basis. The alkalizing effect he described was examined in contexts outside mainstream medicine then. No fraud investigator found he accessed proprietary pharmaceutical development information. The simplest explanation for how he knew the internal applications of a product marketed as a mouthwash is the one that no institution has been willing to put in writing. Case 3. The spinal lesion. In 1935, a woman faced a perplexing medical mystery. Her doctors, despite their best efforts, couldn't agree on the cause of her debilitating symptoms. Then, an unconventional figure emerged, Edgar Cayce. Through his unique readings, he identified a specific structural issue in her spine. He detailed the affected nerve pathways, recommending osteopathic manipulation and specific dietary changes for her recovery. Crucially, Cayce's reading predicted a physician would find a lesion in a specific vertebra. Her doctor, initially skeptical, received this information. He re-examined her and to his astonishment, found the lesion exactly where Cayce had described it. This extraordinary case is preserved in the archives, complete with follow-up correspondence from the physician himself. He documented his findings, noting that the reading directed him to an area he had previously overlooked. A powerful, objective record. The physician, though not convinced, was compelled by the evidence. His correspondence still exists, a testament to a remarkable diagnosis. Case 4, the misdiagnosis. This case was filed in the early 1930s. A woman had spent years being treated for a condition her physicians had classified as functional, meaning psychological in origin. Her symptoms, including persistent abdominal pain and episodes of nausea, had not responded to any treatment, because the treatment had been designed for a condition she did not have. Her family requested a Cayce reading. The reading identified a physical adhesion in her intestinal tract. He described its approximate location and recommended a specific course of osteopathic treatment, followed by surgery if manipulation did not produce relief. She underwent surgery. The adhesion was found at the location the reading had described. Her physicians documented the surgical findings. The pre-surgical reading was dated 4 months prior to the operation. No member of Cayce's staff had met this woman. No physician who had previously treated her had identified the physical cause. The reading identified it from a name and an address. The question this case generates is not whether Cayce was psychic. It is how the anatomical detail corresponds to the surgical finding, if the connection is coincidence. The probability mathematics on that question have not been formally published. The case remains open. Case 5. What the controlled research found. In the 1970s and 1980s, researchers systematically evaluated Cayce's medical readings against available outcome data. Their findings were qualified but significant. Anatomical descriptions were accurate at a rate that could not be attributed to chance. Treatment recommendations showed positive outcomes in a majority of documented cases with available follow-up data. What the research could not establish was mechanism. It demonstrated accuracy without explaining it. The University of Virginia's Division of Perceptual Studies examined aspects of the Cayce archive. Their position: the material warrants serious research, sufficient to preclude dismissal, despite not meeting highest clinical trial standards. This is the institutional equivalent of saying, we cannot explain this, and we are not willing to pretend it does not exist. The failures. The honest case file includes the failures. Cayce made predictions about geological events that have not occurred. He gave readings for individuals whose conditions did not improve under his recommended protocols. He gave business readings that produced no results. He predicted the recovery of specific patients who did not recover. These are in the archive too, and the archive has not removed them. Researchers who approach the material fairly note that the failure rate in Cayce's medical readings, while real, is not higher than the failure rate in conventional medicine for comparable conditions during the same period. That is not a vindication. It is a data point. The more significant failures are the prophetic readings that did not materialize. His supporters' response that human choice can alter predicted futures is unfalsifiable. So is its dismissal. The failures are part of the record. They do not cancel the 5 cases reviewed tonight. They make those 5 cases harder to explain, not easier, because they establish that Cayce was not simply producing accurate results across the board. In the cases where he was wrong, he was wrong. In the cases reviewed tonight, he was right in ways that required information he did not have. That distinction is where the unresolved question lives. Tonight's file reveals a unique feature. The information Cayce produced was not available through any documented channel. No prior patient contact, no access to medical records, nor any pharmaceutical industry connections provided his insights. Investigators, even hostile ones, couldn't identify any mechanism across 80 years of scrutiny. He produced accurate information. Yet, No one has explained the connection between these two undeniable facts. Edgar Cayce left 14,306 documented sessions, explicitly wanting them verified. He cooperated with investigators, submitted to testing, and kept the archive open, believing the record would speak for itself. For 80 years, this extraordinary record has been speaking. Yet, no one has provided a definitive answer.